on to the next point, which is the regional framework for behavioral and cultural insights 2022-2027. For this point, we have a series of documents that we will be examining. So you have these references on the screen. This is the second of the 4 programs of the European Programme for Health. And its aim is also to focus on cultural and behavioral aspects in order to plan the health responses as well as possible for our populations. The Regional Committee 72 is invited to consider a framework for action in this area and to work on the scientific foundations to make a decision on this, and also brings a technical expertise for the countries in this area. So I have the honor of giving the floor to Mr. Rob Butler, our Executive Director, in order to provide us with some comments on this thought and open the debate on this issue. Rob, you have the floor.
Thank you very much, Madam Chair. And good morning again, Honourable Ministers, Your Excellencies, delegates. As many of you, I'm sure, are aware, many of the persistent challenges in our region involve human behaviour. Suboptimal vaccine coverage, overuse of antibiotics, young people smoking, drinking alcohol, poor uptake of cancer screening, or low adherence to treatment of cardiovascular diseases. Indeed, the course of this pandemic, we might argue, has been very much to do with our behaviours, both in terms of the way in which the virus has been transmitted, but also, of course, our efforts to prevent its transmission in terms of mask use, physical distancing, and of course, compliance with social and public health measures. So clearly it's important that we need to understand and do a better job of gaining insights of cultural and behavioural determinants, particularly if we're to provide and present and design more appropriate, user-friendly, accessible and affordable health services. When the RD announced the Behavioural and Cultural Insights Programme Special Initiative as a flagship in 2020, when the European Programme of Work was endorsed after his election campaign, we acknowledged that this area of work would require new disciplines to be brought to the table. It would require social sciences. It would require folks from the medical humanities, not to put more burden and not to place more responsibility on the individual, but to instead place and see the individual and community as a resource as well as a beneficiary. Listening to communities, meeting their needs and expectations, as Her Excellency, Madam Minister of Greece put yesterday, meeting their needs and expectations, and of course valuing social and cultural data in supporting the design of policies and services that are more people-centred and effective. This is by no means the magic bullet, but it can be highly complementary as a facet of public health. And so I think we need to share with you today some examples of behavioural and cultural insights and why this area is such a worthwhile investment. We're now going to hear one example which relates to addressing the alarming threat of antimicrobial resistance. As Dame Sally Davies, former Chief Medical Officer for England, explains in the video we will now watch, national authorities initiated a comprehensive set of actions with support from their behavioural insights team. The intervention they designed together was simple and low cost, and yet achieved very tangible outcomes. So I'd ask us to play this video as an example of BCI in action. Thank you.
The dangers posed by antimicrobial resistance have been known about for decades. However, with rapidly increasing levels of resistance in recent years, the world is only now waking up to the dawning reality of just how unforgiving that future may be.
Antimicrobial resistance, AMR, is the rise of superbugs that don't respond to treatments, and that means people die. We know from modelling that if we don't take effective action, then by 2050 there'll be 10 million people dying every year of superbugs, of AMR.
Fran Husson is just one of millions whose fragile health leaves her vulnerable to AMR, even after surviving several life-threatening illnesses, including leukemia and C. diff.
I've also suffered from MRSA. The hospital team needed to use last-line antibiotics, without which it would have been life-threatening. If we no longer have antibiotics and surgery becomes impossible, I just don't know how I'll be able to cope.
What drives AMR is using treatments, antibiotics, for bacterial infections. So we've got to make sure we use them appropriately.
Put simply, we need to keep antibiotics effective, which means reducing the number of prescriptions to when they are really needed.
There are different ways we can improve antibiotic use. One is by behavioural interactions, and transparency in data is important in that. When I was the Chief Medical Officer for England, we were well aware that there was overprescribing of antibiotics. So we set out to use a behavioural intervention. There was a behavioural insights team, so we went to them for advice. They are experts in this, and they helped us design a trial.
Using behavioural insights methodology and a randomised controlled trial setup, a letter from the Chief Medical Officer was sent to primary care practices with higher antibiotic prescribing rates, providing them feedback that their prescribing level was higher than that of their peers.
By understanding the target audience and their context, behavioural and cultural insights helps us to design more effective interventions. So we asked Dame Sally Davies, the Chief Medical Officer at the time, to write to high prescribing practices and show them how their antibiotic prescribing compares to other GPs, demonstrating that they prescribe more antibiotics than their peers.
I would feel very positive if my GP had received a letter from the Chief Medical Officer.
So this letter highlights to them that their prescribing data is actually monitored, and it also suggests actions they can take to reduce it. It's what's called a social norms intervention. The study was part of the government's target to reduce antimicrobial resistance by reducing antibiotic prescribing by 4%. Using behavioural theory alongside randomised control trial methodology means we know exactly how well it worked, as well as how it worked. The intervention led to 73,000 fewer antibiotic prescriptions over 6 months. That's a 3.3% relative reduction in antibiotic prescribing.
We reduced prescribing in general practice, saving £93,000. So it was worthwhile for the patients and the health service. And interestingly, other chief medical officers have followed, the Australians, the Scottish, and this intervention has worked for them too.
This is a very good intervention which can be applied globally to combat what is probably the greatest threat to humans.
Thank you very much. I now have the honor to invite Ms. Inevita Nagova, who is the President of the European Association for Public Health, UFA, and who is also the head of the Department of Social and Behavioral Medicine and a senior researcher at Pavel Josef Savarik University in Košice in Slovakia to take the floor. She will share with us her comments and her reflections on the subject. You have the floor, madam. Thank you.
Your Excellencies, honorable ministers, regional director, distinguished delegates and friends. In public health today, we have not just an opportunity, but we have an obligation to embrace any evidence-based approach that can improve the health and well-being of the people we serve. Are behavioral and cultural insights an answer to all our dreams and hopes in health? No. But are they an important way forward? Yes, indeed. And are they a good investment? Again, yes. In the background document to the BCI resolution, you will find 14 case examples from different countries of the proven positive impact of BCI in improving health policies, health services, and health communications. I urge you to have a look. But despite these and many more compelling examples, I have to say this: we are nowhere near fully benefiting from the value of behavioral and cultural insights for health. This is because most of our health policies, services, and communications implemented and planned without systematically exploring the barriers and drivers experienced by the people involved, and without rigorous testing and evaluation. I ask you, what can we do to move forward? My answer is, let's start to work together. And this is why I'm grateful to WHO Europe, not only for having placed behavioral and cultural insights on the regional health agenda, but also for reaching out and working closely with officially nominated focal points from each member state, as well as 14 partner organizations, to develop the action framework on our agenda today. This has been a truly inclusive and transparent process, for which I wish to thank the WHO on behalf of both the member states and the partners. The action framework outlines 8 core principles to provide a compass along the journey. It proposes 5 strategic commitments to help with staying on track, and an innovative progress model to help measure how far each member state has come. WHO has produced a short video to introduce these documents, which we will now watch together. Thank you.
When we think about improving health and healthcare, some people may think mostly of biomedical interventions. But our health is as much influenced by behavioral and cultural factors as medical ones, in addition to social and economic factors. Recognition of this complexity is central to reaching public health goals. Understanding the factors that affect health behaviors is vital for informing more people-centered and locally adapted health policies, services, and communication. Public health issues such as obesity, tobacco consumption, antibiotic use, HIV, vaccination, and emergency response are all examples where behavioral and cultural insights are increasingly part of public health activities, helping health authorities to better understand the drivers and barriers behind people's behaviors. The COVID-19 pandemic demonstrated that behavioral and cultural factors have an enormous impact on the public health response. For example, on adherence to basic prevention measures such as wearing a mask or physical distancing, as well as on vaccine uptake. In September 2020, all 53 member states of the region adopted the European Programme of Work, identifying behavioral and cultural insights, or BCI, as a flagship priority, paving the way for the regional office to establish a BCI unit. The WHO BCI unit has worked with member states and a broad range of partners to develop an action framework on BCI for the European region. The vision is ambitious but realistic if we invest and work together to achieve it. A region where health policies, services, and communication deliver better health and reduce health inequity through the systematic application of BCI approaches in their development, implementation, and evaluation. Member states agree on 5 strategic commitments. To build understanding and support of BCI among key stakeholders, to conduct BCI research, to apply BCI to improve outcomes of health-related policies, services, and communication, to commit human and financial resources to BCI and ensure their sustainability, to implement strategic plans for the application of BCI for better health. To fulfill these commitments, we need to invest in new, enabling structures and strategies, bring on board experts from the social sciences and health humanities, and engage in meaningful long-term partnership with a broad range of actors and communities. The WHO BCI unit will commit to providing technical support and guidance to countries. WHO will also monitor progress and convene meetings for member states, international organizations, and non-state actors to review and discuss progress, present best practice examples, share evidence, and promote peer exchange. We would like to thank the BCI focal points in all member states and the many partners who worked tirelessly together with us to develop this action framework. And we look forward to continuing this exciting new journey with all of you.
Merci beaucoup, Iveta. Je vois que la
Thank you very much,
Turquie a levé
Iveta.
son drapeau, donc je me permets de demander est-ce qu'il s'agit d'une demande urgente ou est-ce qu'il s'agit d'une demande de prise de parole
I
dans le
believe
débat.
that one country was raising their flag. I just want to know if this was an urgent request for the floor, was it an urgent request for the floor, or are you just asking to be added to the speakers list? Thank you very much for clarifying.
Thank you, Chair. Turkey would like to speak on BCI agenda item.
Très bien, merci. Donc je vous
Thank you very
ajoute
much. Okay,
à la
wonderful.
liste.
So I will add your name to the
Donc,
list
je
then.
me
Thank you.
tourne maintenant
Now
vers
allow
le
me to
professeur David
move on
Halpern,
to Professor David
directeur
Halpern,
de l'équipe
who is the
sur
director
les
of
aspects
the
comportementaux, et également
behavioral
conseiller
team,
national pour le
and he's
Royaume-Uni
also
sur
working as the CEO of the Behavioral Insights
fonctionne.
team in the UK's What Work National Advisor. Professor David Halpern, you have the floor. Go ahead, sir.
Thank you so much. And by the way, thank you for condolences from many people, which people in the UK very much appreciate. We thought the Queen was going to live forever. I'm going to come and join you, actually, just to wake you up. But let me start with a story from years ago, actually, when I worked for Tony Blair. I worked for a few different prime ministers 20 years ago, and we'd done this piece of work for him around behavior change, because most policy, getting people to pay their taxes or work hard in school and so on, involves behavior, and so did health. So there we were in the office of our health minister talking about, well, what could we do around other things to, for example, get people to quit smoking more rapidly. And the health minister's main advisor leaned across and he said, wait a minute, if people don't quit smoking, they die. What more possible incentive or nudge could you possibly need? Well, it's an interesting point. But that's the thing about human beings. You too. So how many, if I might ask for a minute, have had a reminder to have your cancer screen, for bowel or cervical, and you didn't get around to it? You're pretty busy people. I'd include myself. Or in the last couple of days, with the endless wonderful desserts we've had, how many of you ate a few more desserts than you probably intended to? Come on, honestly, right? Or you've seen a beautiful beach. How many of you brought a swimming costume and you haven't taken it out of your case? Now, it's not just because you're lazy or whatever. It's the timing. You're busy people. We built a world, unfortunately, where it's much harder than it should be to live healthily. And that's the fundamentals of what we're trying to do around behavioral insights and cultural insights. So there are two main areas where we can use them. You've seen this, and Hans talked about a lot of detail. One is around clinical services, where we can use better behavioral understanding of our patients, doctors, to make effects, and also, of course, trying to do something about the 60% of years of healthy life, which are to do with behavioral and lifestyle factors. COVID, of course, as we know, has reminded us all about this. It's been behavior, asking people to stand further apart. That's okay for Brits, we're used to that. But asking people to cover their faces, right, to wash their hands. Our first line of defense was behavioral. So was our second line of defense when we asked people to come in for testing. Will they come in for testing? Will they self-isolate when we ask them to do so? Are we better off to send them a text or a phone call? We ran a trial on that, definitely phone them. And even when we've got a vaccine, well, a vaccine is not a vaccination until someone says they turn up for an appointment and you can put it in my arm, right? It's behavior, behavior, behavior. So, if we go on that. Again, Hans talked very powerfully about this, but just this is a kind of typical estimate we have used for countries like the UK, France, Germany. How many years of life, on average, are we losing for these kinds of factors? It's 2 to 4 years, we think, from diet alone. Smoking, 1 or 2, but of course concentrated in certain groups. And Hans talked about lots of these other issues too, such as social isolation, quite big effects. And these, if it's 5 to 10 years on average, amongst the more disadvantaged, it's typically double that. These are huge effects. So what can we do about it? And I'll just try and draw out some kind of common themes. A very simple framework we sometimes use, you might find useful too. 4 words. And you can almost use them across the piece. You want to affect human behavior? Think about making it easy, attractive, social, and timely. I'm just going to spend a few minutes giving examples on each of those. And pretty much all of these are backed by large-scale, randomized controlled trials. So make it easy. What does that mean? That's the life equivalent of when you get to the canteen, do you come first to the chips or the salad? Because human beings fill their plates with the first thing they come to, right? Okay, fine, that's a small example. But here's one that my colleague Helen just picked this up this morning. My specimen number 1 is a cereal bar. You probably have something pretty similar. It's from here in Israel. And on the back, you can see on the side, there's the little nutritional information. Right, it's all there. It's been there for years. Well, does it affect your behavior? Are you aware of the difference, or are your citizens? Are they all the same cereal bars? No. If you analyze a typical selection of cereal bars in one of our countries, they vary in the level of sugar by 5-fold, 500%. They vary in their level of fat by more than 10-fold, 1,000%. And guess how much they vary in their level of salt? 40-fold, typically range. So there's a lot of differences, but the labels aren't getting through. So you want to design a label, as the French have done, Nutri-Score or Singapore, that actually makes a difference to your behavior. And then, of course, the beauty of that is that drives a reformulation of the products. It's not just about the individual level. It's actually as much and often more about how our behavior nudges other people in the system. Similar examples on the clinical side. So from Moldova, the fantastic work on tuberculosis, where to get people to comply with medication is by doing it as video, making it easy so you don't have to go to your doctor, leads to more than doubling of compliance. Make it easy is a very, very big deal. Attractive, how do we break through? How do you make it kind of puncture your attention? So going back to, say, cancer screening, we ran a trial for people who kept not turning up for cancer screening, where if it was breast cancer, we said, we've entered you into a competition for an iPad for you or an inspirational woman that you know. 17% increase in the turnout rate for an iPad. Just a competition for many, right? You don't automatically win it. Similarly, price, of course, a very big deal. If you can make something marginally more or less appealing, like a drink, particularly if there's a substitution, you can get very big impacts. So the UK sugar levy, for example, has led to now pretty much a halving in levels of sugar in British drinks. And by the way, sales have gone up. So drinks manufacturers, instead of shouting at us, saying, why don't you do it everywhere else? And it's a good question. So, attractive. Social. Human beings are very influenced by what other people are doing. So the antimicrobial resistance study, which you just saw a few moments ago, one of the reasons why it works is that even highly educated doctors are influenced by knowing what their peers are doing. And in fact, in further revisions of that intervention, if it goes to individual doctors, it's 3 to 4 times more powerful, 12% impact size, and you can adjust it in relation to different groups too. So pretty big impacts. Or Hans talked about pollution. There's a reason why we're now introducing green tags on electric vehicles on your number plate. Why do we do that? Because we want it to be that everybody can see that you're driving an electric vehicle, because habits are contagious, right? Not just diseases, habits are too. And then finally, timely, incredibly important. There are certain moments when your behavior can be disrupted. And a lot of what we're talking about are habits, right? They're habits. You get up and do the same thing. You're in a loop. So, for example, if you want people to exercise more, get them to cycle, generally, even going one-to-one doesn't make much difference. When does make a difference? If you've just moved house. If you go to someone who's moved house in the last 3 months and you say, there's some cycling options here, you get 3 to 4 times increase in the uptake because your habits have been disrupted. So when's the key moment to make your intervention? So, against that background, I've tried to show you there are actually very effective behavioral interventions on many fronts. Been lots of discussion about drugs. This is what's sometimes called Eram's Law. You may know it from back to 1950. Roughly every 9 years, it costs us twice as much to get the same impact. So why wouldn't we try out some of these behavioral implications or interventions, at least alongside? Make our money go further. The final question you might say is, well, that's all very well, David, but it's the politics too. Many of you will be ministers thinking about that. Do the public really want it? So at the same time as we were setting up for David Cameron in Downing Street, the Behavioral Insights team, we're saying, well, what do people think? Are they supportive of things like banning unhealthy foods, banning smoking, etc.? You can see America is actually the weird one here. Americans don't really like their government to be telling them what to do, but actually in many countries, actually Sweden's interesting too, but actually a large majorities of people actually expect the government to intervene on these things to make it easier for them to live healthier lives. So just a final reflection, if I go back to that conversation, it's basically 20 years ago, trying to persuade our Department of Health to be more interested in a wide range of things such as on smoking. Since then, 150 million people in the world, right, have died from smoking. Right? Of course we should be trying to do these things. And essentially, the simple idea is we should try and make the world easier to live healthy in, right? That's the basic idea. If we can do that, we can have very big impacts indeed. Thank you very much.
Merci beaucoup, David.
Thank you very much, David. Thank you also for reminding me personally that there is a beach right over here. I would just like to now open the deliberations. Member states are welcome to speak. The Czech Republic will start us off. Czech Republic, go ahead.
Madam Chair, distinguished Regional Director, Excellencies, colleagues. I have the honor to speak on behalf of the European Union and its member states. The European Union and its member states thank the Secretariat for drafting the framework and related resolution. Public health has witnessed major developments and improvements during the recent decades. We have moved from medical and disease paradigms of health with a problem-oriented approach to understanding that health is made up everywhere in our societies, not only across the health systems and services, and that societal and environmental factors have a decisive impact on health. Alongside the better understanding of the links between risk factors and diseases, we now know that psychosocial determinants contribute to health and well-being. Even more, we have increasing evidence of their often unequal and inequitable distribution across the population. We are now used to work with health in all policies and the whole of government and the whole of society approaches for health. Although behavioral science has always been relevant to the development of health literacy and health education, it has now been recognized also as a potential tool for the development of health policies and services and their implementation, as well as for communication by emphasizing the user or recipient perspectives and responses. We welcome the objective of this framework to increase the exploration and utilization of BCI throughout the policy cycle in the development of health-related policies, services, and communication which aim at achieving better health and at reducing health inequity and inequality in our region. There is a decade-long experience in using BCI to improve health literacy in order to equip people for making healthier choices with regard to lifestyle-related health risks. We now understand that BCI can contribute to improved compliance to interventions by increasing the understanding of, among other things, people's preferences and barriers for realization in practice. As part of a comprehensive approach to policy design, BCI also should be used as an important tool for the development of health-conducive environments and choices. In complementing other public health approaches, the regional BCI framework has a high potential to strengthen the promotion of health and well-being and to reduce the burden of NCDs. As BCI is a novel tool, the exchange of experiences and good practices will be important, as proposed in the strategy, in addition to the generation of evidence-based research and evidence-based approach. We look forward to continue working together with academia, civil society representatives, communities, and global and regional partnerships in order to reduce expenses and improve access to and quality, equity, safety, and sustainability of health services, as well as to develop people's everyday environments while benefiting from increased cultural and behavioral understanding. The European Union and its member states support the adoption of both the European Regional Action Framework for Behavioral and Cultural Insights for Health 2022 to 2027, as well as of the related resolution. The resolution differs significantly from the more procedural ones we have had in the past and could therefore have benefited from open earlier consultations with all member states, like most of the other resolutions discussed at this meeting. Thank you.
Thank you very much. I shall now give the floor to Ireland, to be followed by Romania and then Croatia.
Thank you, Chair. Ireland aligns itself with the statement of the Czech on behalf of the European Union. Ireland welcomes WHO Europe's development of the Action Framework for Behavioural and Cultural Insights for Health. We have used Behavioural and Cultural Insights, or BCIs, to achieve improvements in health system performance and population health. We believe that the Action Framework will help Ireland and other Member States to enhance the development and application of BCIs. Therefore, Ireland supports the adoption of the resolution and the implementation of the framework. I would like to acknowledge the truly collaborative approach that has been taken by WHO to develop the resolution and action framework. Ireland has been actively engaged for months on the development of this framework. In Ireland, we have focused our efforts on three main areas where we have applied BCIs to improve the outcomes of health-related policies, services and communication. Number one, patient engagement. How best to support patient uptake of health services. Number two, healthy eating. How best to support individuals to make informed, healthy choices. And number three, healthy behaviours. How best to encourage positive public health actions. I would like to speak briefly about an example which demonstrates the benefits of the behavioural and cultural approach. BCIs have played an important role in Ireland's response to COVID-19. We used BCIs to design a leaflet on the importance of hand hygiene, and that was sent to all households. We also investigated barriers to COVID-19 vaccine acceptance and tailored a national communication strategy to support higher uptake. Ireland had one of the highest rates of uptake of COVID-19 vaccinations in Europe, and we believe these actions contributed directly to that result. For these reasons, we are convinced of the benefits of a more structured approach to the development and application of BCIs. We welcome the WHO initiative in this area, which we are happy to support. We look forward to continuing to work with WHO and Member States on BCIs in the coming years. Thank you.
Thank you very much, Ireland. I shall now give the floor to Romania, that will be followed by Croatia and the Republic of Moldova.
Thank you, Mrs. President. Regional Director, first I want to congratulate Professor Harpet for the very interesting and interactive presentation regarding this important subject on the agenda of this regional committee. Romania support the declaration of Czech Republic on behalf of the EU member states, and also it's very open to support this European Regional Action Framework for Behavior and Cultural Insight 2022-2027. And also I want to comment a little, because we discussed until now about the impact of these behavioral and cultural insights on developing preventive measures in member states to improve the healthy lifestyle. And I think there are some conclusions also after this pandemic, because we saw a big difference between countries in different regions of Europe regarding vaccination coverage, regarding access to and also utilization of testing. And many of these things influenced our lives and the evolution of the pandemic in a different way. And of course, these were influenced by the behavior of people, and because we discuss about behavior of person, of individuals, behavior of communities, and behavior of people regarding public health issues. And all these things I think should be addressed in this extensive framework we discuss about, and Romania is open to host a center to integrate all these needs if the regional committee and the member states will consider this in the future. We fully support, and we are open, as I already said, to develop this very important tool we have in our hands, especially for the next year, when many of the challenges we saw today will go on. Thank you very much.
Thank you very much, Romania. I shall now give the floor to Croatia, to be followed by the Republic of Moldova and then Slovakia. Thank you very much.
Dear colleagues, Croatia would like to align to the statement of the EU and member states. We welcome the European Regional Action Framework for Behavioral and Cultural Insight for the Health 2022-2027. Our country is also committed to support implementation of the European Programme of Work 2020-2025, United Action for Better Health in Europe, which identifies behavioral and cultural insights as a flagship priority. It is of great importance, especially in this day and age, to recognize, investigate, and apply the above-mentioned insight to improve the health of our citizens. We need to follow the lead and example of the WHO and recognize BCI as a public health priority and a framework to help us guide research and interventions, allocate financial and human resources, tailor activities in primary and secondary prevention, and evaluate and disseminate relevant findings and our progress. Recent ongoing pandemic has also put in focus the need to determine how various psychological, cultural, and social variables influence behaviors related to vaccination and adherence to COVID-19 preventive measures. We especially welcome the importance of BCI in improving the uptake of preventive programs, including vaccinations, as well as the uptake of cancer screening programs. In cancer screening programs, where we are particularly proud to have recently launched a national lung cancer program, in increasing the uptake of preventive and screening programs, we especially recognized two moments as key in approaching the cultural and behavioral needs of the population. The uptake of preventive and screening programs largely depends on the engagement of healthcare workers. The education and positive attitude of health workers is of the utmost importance. Furthermore, cooperation with NGOs plays a special role. NGOs can recognize the needs of citizens and the specificities of individual groups of citizens they represent. This is why in Croatia we are increasingly involving NGOs already in the adoption of strategic documents as well as in the implementation. A good example is the National Plan Against Cancer 2020-2030, which was written in such a way that together with experts, 9 NGOs representatives were involved in the drafting of the national plan. We strongly advocated to continue the efforts in this area and applaud the valuable work done by WHO and all member states. We are ready to collaborate with the WHO Regional Office for Europe on applying BCI for improving the health and lives of our citizens. Thank you.
Thank you very much, Croatia. I shall now give the floor to the Republic of Moldova, to be followed by Slovakia and then Cyprus. Moldova, you have the floor.
Thank you, Madam President, dear Director General, ladies and gentlemen. The Republic of Moldova joins other member states in welcoming this ambition, an important action framework that will help us improve the health and well-being of our citizens. We see that behavioral and cultural insights is adding value through an evidence-based and person-centered approach to taking some of the critical health issues we face, such COVID-19 pandemic, vaccines uptake, antibiotic use, alcohol consumption, and other NCD risk factors. The Republic of Moldova was one of the first countries which implemented a new tool developed by the WHO Regional Office for Europe, a flexible and cost-effective one, for measuring and monitoring of public knowledge about COVID-19 risk perception, behavior, and trust. To date, the Ministry of Health jointly with WHO has used BCI through the collection of 6 rounds of behavioral insights survey data during the COVID-19 pandemic. Prompt data help country to tailor COVID-19 outbreak response actions, including some policies on public health interventions, and adjust risk communication and speak directly with communities, youth, and elderly people. To build a trust, mayors from villages, postmen, border police, volunteers from Association of the Medical Students and Residents, and young volunteers from Red Cross were involved. BI data showed that young people were less likely to follow recommended public health social measures and were consistently less likely to say they would get vaccinated. As this population became eligible in Moldova, specific efforts were needed to increase acceptance. The Ministry of Health and WHO Country Office engaged with university, rectors, and Association of the Medical Students and Residents to implement a peer-to-peer campaign, Put Your Shoulder In. Medical students visited other universities and colleges and provided offline and online information sessions to encourage students to get vaccinated, using their own experience as an example. More than 90% of them were vaccinated. The Republic of Moldova is also committed to increasing the use of BCI to support the design and implementation of health policies, services, and communications in relation to key public health challenges. These include alcohol consumption, which is a key issue for our country, and we believe BCI can be part of the solution. In July this year, more than 30 Moldovan members of parliaments and policy makers attended a 2-day workshop on alcohol policy to learn more about international evidence, as well as how BCI can be used to strengthen the planning and implementation of alcohol policies, including understanding and improving the public acceptability of effective alcohol policies. In closing, the Republic of Moldova would like to reiterate its support for the BCI action framework and resolution. We believe this is a very timely initiative that stands to benefit us all. Thank you for your attention.
Merci, la République de Moldavie. Je rappelle évidemment tous les I call all member states, of course, to keep to the 3 minutes so that we can move forward quickly. I will pass the floor to Slovakia, followed by Cyprus and Slovenia. Slovakia, you have the floor.
Do you hear me? Yeah, okay, thank you. So, Executive President, Slovakia aligns itself with the statement of the Czech Republic on behalf of the EU and its member states. We would like to thank the Secretariat, together with member states, for developing this important agenda, supported by a number of evidence-based documents related to behavioral and cultural insights for health. BCIs are a major significance with a view to tackling NCDs as well as to achieve sustainable development goals. The BCI action framework has a strong potential to help to reduce health inequalities in the region, given that BCI interventions are cost-effective and efficient at the same time. With this, Slovakia would like to inform about its co-sponsorship of the resolution. The framework contains strategic commitments, objectives, and implementation guidance. And we deem it crucial that the respective guidance related to capacity building, education, and training of the health workforce is accordingly elaborated as well. Moreover, we support and research good use and acceleration in all types of environments and populations as one of the essential components in the process of implementation. The evidence-based approach is necessary in order to ensure continuous review and evaluation, including effective adoption of the legislations and other implementing instruments. Therefore, we recommend to consider establishing the expert working group comprised of the member states in order to increase the effective implementation of the research, evidence, knowledge translation, and knowledge mobilization in regard to the BCI agenda in the region. Mindful of the fact that pursuing a healthy lifestyle is a matter of both the individual as well as public and private actors who have the capacity to influence a variety of measures, we consider the BCI a strategic approach towards protecting and promoting health in general. Concluding on a slightly technical note, we would like to suggest that WHO Euro SCRC considers the possibility of initiating the consultation procedure sooner and more inclusively to all those interested, given the complexity of the tabled documents. Thank you.
Thank you, Slovakia. The floor goes to Cyprus, then we will have Slovenia and Kyrgyzstan. Cyprus, you have the floor.
Honorable Chair, distinguished Regional Director, Excellencies, ladies and gentlemen, Cyprus would like to align with the statement delivered on behalf of the European Union and its member states, and is joining the member states in the WHO European region in their efforts to improve the health and well-being of its citizens. Individuals' health-related behaviors and social circumstances together make a major contribution to their own, and in many cases, other people's health. The overarching objective of the proposed action framework is to set the course for behavioral and cultural insights work through joint commitment to actions and targets where health-related policies, services, and communication deliver better health and reduce health inequality in the WHO European region. We must listen to people's concerns, acknowledge them, and give them information so that they can make an informed decision. Furthermore, we must tailor our health policies and health services to the needs and convenience of the people whose health we wish to safeguard. Cyprus' strong commitment to conduct BCI work for better health is demonstrated by the following two examples. Number one, at the Ministry of Health, instead of beginning with a public health campaign alone to target vaccine hesitancy during the pandemic, we have incorporated behavioral and cultural science as a starting point to consider psychological, social, as well as economic factors that affect how people behave and think. Social norms, attitudes, needs, and wants of the target audience were considered in designing behavioral and cultural interventions. Number 2 is the National Strategy for Active and Healthy Aging, which is currently being developed against the backdrop of a series of behavioral and psychological factors. For example, physical activity, smoking, and other health behaviors, cognitive and social engagement, personality, and psychosocial stress do play a critical role in health across the lifespan. Therefore, by identifying the psychological, behavioral, and social processes that influence health and quality of life, we will be able to reinforce prevention efforts, enhance symptom management, and conserve function among older adults. In closing, we reiterate that Cyprus strongly supports the BCI resolution and action framework. Thank you.
Merci Chypre.
Thank you, Cyprus. The floor goes to Slovenia, followed by Kyrgyzstan, and then Sweden. Slovenia, you have the floor.
Thank you, Chair. Thank you, David, for your presentation. It was very illustrative. Slovenia allies itself with a statement made by Czech Republic on behalf of the EU. We would like to congratulate the regional director and his team for putting forward this new flagship initiative. The new framework will supply us with tools to bridge gaps in the implementation of health policies that have had unexpectedly lower performance and impact than predicted. A very telling example is COVID pandemic. Despite outstanding biomedical, logistical, and technical efforts to develop and distribute vaccines, we have witnessed vaccine hesitancy. Many opportunities to save lives were lost, as was and still is the case in tobacco control. We are convinced that behavioral and cultural insights will be instrumental also in addressing dis and misinformation, and of course, decades-long challenges such as AMR, NCDs, and their risk factors. They will also be helping us in increasing health literacy of our population, but not only population, also professionals and health literacy, even in decision-making and in media. We need behavior and cultural insights, especially when it comes to new threats to health, such as novel tobacco products, non-substance addiction, or, for example, normalization of cannabis, but also in implementing best buys, which we all know it's very difficult. For the success of this framework, we believe it is crucial to bridge silos and work with diverse relevant stakeholders. We cannot reach the most vulnerable without partnership with civil society. We cannot address the needs of young people without involving them through their organizations. In Slovenia, we will continue to work closely with relevant non-governmental organizations, which has already paid off so many times. Here, we call for their meaningful inclusion at international level. They are key for the implementation. Thank you.
Merci la Slovénie.
Thank you, Slovenia. The floor now goes to Kyrgyzstan, followed by Sweden, and then the Netherlands. Kyrgyzstan, you have the floor.
Приветствую всех, уважаемый президиум, уважаемые коллеги.
Everybody, President, colleagues.
Да, забегая вперед, я хочу сказать, что Кыргызская республика тоже поддерживает всесильно рамочную конвенцию.
The BCI framework. And BCIs are a key part of reducing negative health impacts. Prevention are, without a doubt, extremely advantageous to maintain human capital and particularly to maintain resources, human resources. First of all, habits, as our experience shows, have a clear influence on all health indicators. And the pandemic showed us that we need to learn to live with COVID, and the most effective method is immunization and a correct behavioral attitude to immunization campaigns and effective collaboration on this for multi-sectoral aspects at the level of regional and country structures leads to very positive results. The Kyrgyz Republic also declares that we support the BCI framework. Thank you for your attention. Thank you, Kyrgyzstan. The floor now goes to Sweden, that will be followed by the Netherlands, and then Armenia. Sweden, you have the floor.
Thank you, Chair. Sweden aligns itself with the statement made by Czechia on behalf of the EU and its member states. Sweden would like to compliment the Secretariat for their excellent work on this area. We recognize the importance of behavioral and cultural insights as a powerful tool to strengthen and develop public health in order to reach our overall goal in Sweden, with a clear focus on health equity and a sustainable society. The Swedish public health policy adopted by the Parliament consists of a framework for implementation and monitoring with a focus on 8 target areas of follow-up and intervention. Thus, the resolution is in line with our goals on public health policy, and we are happy to co-sponsor the resolution. At a technical level, we have been active in drafting of the resolution and action framework. Behavioral insights provide us with tools to understand at an individual level and according to different social and cultural contexts what are the drivers and barriers of behavioral change. In Sweden, BCI has, for example, been used as a complement to medical and epidemiological data and knowledge in the management of the COVID-19 pandemic, relating to both the implementation of physical distancing and hand hygiene measures, as well as relating to acceptance for vaccination. Other examples of where BCI is an integrated part of the public health policy in Sweden include promotion and prevention in the areas of use and sustainability of antibiotics, as we heard of in the presentation, in mental health, tobacco and drug control policy, and also in lifestyles and physical environment areas. Relating to the work with vaccine acceptance with focus on the national childhood immunization program, we have worked intensively for the past 10 years with the WHO tool tailoring immunization programs. And we are performing now a study through a behavioral lens to adapt the communication on vaccine programs in geographical areas with lower vaccination coverage. The work done in Sweden can also provide, I think, a useful case study for other countries. Sweden is committed to continue the work with BCI and integrate its method into the Swedish framework for public health policy. Thank you for your work, and thank you for having the possibility to support it through this intervention.
Thank you, Sweden. The floor now goes to the Netherlands, followed by France and then Denmark. The Netherlands, you have the floor.
Yeah, thank you. Dear Chair, Director General, Regional Director, and distinguished colleagues. The Netherlands aligns itself with the statement made by Czechia on behalf of the European Union. In addition, we have the following remarks. Let me start by expressing our appreciation for the fact that WHO, both in Europe and worldwide, is approaching behavior and cultural insights in a very constructive and scientific manner. To resolve the COVID pandemic, we learned quickly that our behavior was the biggest challenge, and that we need scientific insights in determinants of the different behavior involved. In the Netherlands, we set up our own Corona Behavior Unit. We involved top experts in psychology, sociology, and communication science, as well as expertise regarding different cultural groups. Using both qualitative and quantitative methods, as well as literature review and international exchanges, we were able to provide insights on perceptions and behaviors necessary for impactful governmental policy. This is exactly what the WHO advocates in their BCI framework. Indeed, BCI insights are also immediately relevant to other major health threats, such as the global increase in NCDs and prevention policy and practice to address the underlying determinants of health. To realize the ambitions of the framework, we look forward to work together, learn from each other, and share evidence and lessons learned. Although we have learned a lot during the pandemic and in other public health challenges, we would like to keep improving and learn, as people behaviors matters. As governments with public health responsibilities and an aging, diverse workforce that we need to keep as healthy as possible, we look forward to the lessons that follow from a scientific behavior and cultural insight approach. And we are really willing to share case examples and collaborate with other member states in this area. For this, we urge member states to endorse the BCI framework of the WHO. We urge you to strengthen the scientific behavior and cultural insights within your countries to support quick and sound governmental responses in public health. We encourage member states to apply a broad range of BCI approaches to their health policy, ranging from communication strategies, financial stimuli, adaptations in physical surroundings, and many more. So, also in this respect, I can only say, let's learn from this pandemic and make sure that the world as a whole is better prepared for the next one, also in regard to BCI. Thank you.
Thank you, the Netherlands. The floor now goes to France, followed by Denmark, and then Armenia. France, you have the floor.
Merci Madame la Présidente, Monsieur le Directeur Régional. La France
subscribes to the declaration made by Czechia on behalf of the EU and its member states. Take into consideration the cultural particularities and the social stakes in each territory for each individual is advantageous for healthcare policies that can therefore be more adapted to the needs of the population. That's why France supports the BCI framework for Europe. In France, this strategy is in line with democracy in healthcare. We believe that personal, cultural, educational factors, psychological, contextual factors, as well as socioeconomic and environmental factors, have a direct impact on people's health, their ability to access healthcare, as well as their understanding and reaction to recommendations by the healthcare teams. Our experience has shown that using BCI helps people make healthier choices, bettering their understanding of recommendations. They create a favorable environment to healthcare and contributes to equity in healthcare for all. Thank you for speaking about the Nutri-Score, a public health initiative that was elaborated in France, which changes behaviors and brings in consumers and changes the food supply. This has a sustainable impact. This has also been pushed with the support of various European countries. France wants to underline the importance of one of the 8 key elements, active participation by citizens, that we call democracy in healthcare, also called social participation or active participation. This active participation gives a voice to the relevant community so that they can share competences, skills, views specific to each population and group. This is particularly important in order to reduce inequalities. We need to take into consideration the most remote or discriminated against people whose voice is often not heard or taken into consideration. To ensure efficient and equitable participation, France believes it is crucial to firstly have institutionalized mechanism to give the population a role in the decision-making process, and secondly, to have methods that create a continual dialogue with the proper management of conflicts of interest. France is ready to collaborate actively to implement systems in this framework and to work with WHO Europe in favor of everybody's health. Thank you. Thank you, France. The floor now goes to Denmark, followed by Armenia and then Norway. Denmark, you have the floor.
Thank you, Madam President. Denmark fully aligns itself with the statement made by Czechia on behalf of EU and its member states. Denmark thanks the Secretariat for the action framework and the related resolution on this very important matter. We commend the ambitious visions for better use of behavioral and cultural insights to improve public health in our region. We believe that BCIs are cost-effective measures for governments and for other stakeholders to optimize health policies, services, and communications. We believe that systematic and efficient use of BCIs can tackle persistent health challenges that involve human behavior. Better understandings of risk perception and misperception, of trust and acceptance, and of barriers and drivers for behavior can all help to counter challenges such as vaccine hesitancy and adherence to preventive measures. In Denmark, we have used BCIs proactively to ensure high uptake of COVID-19 vaccines across different population groups. We worked closely with leading behavioral scientists, and we used finely granulated real-time data on behavior and trust in developing public health initiatives during the pandemic. By this evidence-based approach, and by engaging with community leaders and local stakeholders, we were able to fine-tune our initiatives to diverse communities in our country. With this, we achieved a high vaccine uptake, also in usually hard-to-reach populations. We have also applied this approach and the lessons learned from COVID-19 in our response to the recent outbreak of monkeypox. We worked very closely with the LGBTQ+ community, using innovative channels of communication and using alternative outlets for health services and using non-stigmatizing and inclusive language. Denmark welcomes the initiative to further explore and utilize BCIs in our region. We agree on the importance of strengthening coordination and exchange of good practices among member states across our region as proposed in the action framework. And we look very much forward to share experience and knowledge within this framework. Thank you very much, Madam President.
Merci, le Danemark.
Thank you, Denmark. The floor goes to Norway, followed by the Russian Federation. And we will then go to our lunch break. Norway, you have the floor.
Thank you. Regional Director, colleagues, we thank the Regional Office for developing a strategy in this area. Experiences from recent years, not least during the pandemic, have clearly shown that understanding the cultural context of health behaviors is key to protecting and improving public health, not only in specific groups, but in the whole population. The increasing cultural complexity of our populations underlines the need for authorities to understand, through participation and interaction, the varying social context and circumstances that produce different patterns of health-related behaviors. Norway therefore fully supports this initiative, while also stressing that a better understanding of behavioral and cultural context cannot replace, but on the contrary, must build on universal health coverage and good public services affordable for all. Thank you, Madam President.
Merci, la Norvège.
Thank you, Norway. The floor goes to the Russian Federation.
Глубоко уважаемый председатель, глубоко уважаемые делегаты.
Delegates, the Russian Federation welcomes the BCI framework for health. Russia sees the inclusions of BCIs as a key part of creating healthcare programs. The anti-tobacco and anti-alcohol policy of the Russian Federation are underpinned by measures that impact the behavior of people, including increasing taxes, reducing access to tobacco and alcohol, as well as banning publicities. These have shown that they work over the last decade. The consumption of alcohol has decreased significantly from 15.7 liters per person to 9.1 liters. Tobacco consumption among adults fell from 39.5% to 20%. Russia is also a multi-ethnic and multicultural country, and that's why every program on healthcare is implemented taking into consideration the local context, including a fair participation of our regions in elaborating these programs as well as ensuring their autonomy. This unique experience of cultural adaptation can be useful to the countries of the European region, and we are ready to share this experience and work together. Currently, within international collaboration, the Russian regions, as part of an agreed single protocol among countries, has conducted research on assessing the risk factors for health diseases, healthcare literacy, as well as the consumption of alcohol and diet. We are ready to compare results and organize programs to ensure a healthy lifestyle for maintaining health among people. The Russian Federation approves the resolution project on BCI factors, and the Russian Federation is committed to its objectives, its principles, to the strategic obligations, many of which already have a political, legislative, legal and financial support and are being implemented as part of national priority projects in our country. Thank you.
Thank you very much. Thank you to Russia. We will now have a break and we will meet again at 2 p.m. to continue our debate. I would like to remind delegations that informal consultations are being held at 1 o'clock in room 8 under the leadership of Mr. Nielsen and the delegate of Portugal. I hope you all have an enjoyable lunch, and we will meet back here at 2 o'clock after the lunch break. Thank you and bon appétit.